Hi, my name is Johanna Murphy, and I'm going to present on the cytochrome P450 2D6 enzyme, CYP2D6 enzyme for psychopharmacology today. The CYP450 system, of which the CYP2D6 enzyme is a part, accounts for 90% of the enzymatic reactions necessary for breaking down or metabolizing medications. The CYP2D6 enzyme is involved in about 25% of those, and particularly with psychiatric. This is more information about drug metabolism. The CYP450 system, including the CYP2D6 enzyme, is part of the phase 1 of metabolism, and in which the lipophilic molecules are changed to hydrophilic molecules so that we can utilize and eliminate them. And then this is showing the first pass and second pass metabolism that's a part of that. This is an important review for me, maybe more familiar for all of you. So, as we've previously mentioned, the CYP-mediated enzyme system is essential to metabolism of all drugs. This just gives some examples of how important, and also breaks down how the CYP nomenclature is set up. And then the substrates are the medications that we need to look at to find out whether we're going to have an inhibitor or an inducer. So, for example, we don't know for sure that there are any particular inducers of the CYP2D6 system, although dexamethasone and prednisolone steroids are being looked at more closely. But what we do know is that there are moderate and strong inhibitors. And many of them are within the antidepressant and antipsychotic class. There are also some miscellaneous medications here. Please notice the diphenhydramine, but it is important that this is a weak inhibitor and doesn't necessarily mean that a medication that has an interaction with this inhibitor cannot be used with diphenhydramine. So, what we do need to be very careful about are particular medications that are really important. Tamoxifen in breast cancer treatment can be inhibited if the CYP P2D6 enzyme is inhibited, and it can be inhibited by many medications, but as we just saw, particularly SSRI antidepressants, fluoxetine, can inhibit the enzymatic reaction of activation rather, of the CYP2D6, which can mean that the tamoxifen efficacy is dramatically lowered. We first found this out more with opioids, particularly codeine. So if a person genetically isn't able to metabolize with the CYP2D6, then they may not actually find much relief from codeine or tramadol. But clearly, tamoxifen would be something that we would not want to interfere with, and we would want to choose a different antidepressant for that person. And then, even though we don't have an inducer to talk about, what can happen is that because certain medications require the CYP2D6 enzyme for deactivation or metabolism, if that is inhibited, because we've got fluoxetine, for example, again, not allowing the other medication to utilize the CYP2D6 enzyme, then the concentration can be increased and it's just floating around and it can become toxic. So important medications that we use every day would include beta blockers, and certainly in psychiatric care would include antipsychotics and even acute emergency medications like Haldol. So we may be utilizing this knowledge as a therapeutic purpose. A lot of the off-label work is done that way, or just a knowledge of the particular person, their epigenetics, their genetics, their history, and their combination of medications may all be something that we take into account, but we need to be aware.